Just 1 second.
Hi, good morning. So this is skin management and products and the appropriate products for the appropriate skin disorders, whether you have dry skin or you have moisture to manage. We have all those products. We've invested a lot of money in prevention here. We have products everywhere. Everybody's RX doesn't keep the same product line in. So feel free to always call downstairs if you feel like you need a product. We have, whether you're doing a regular bath with soap and water or our body cleanser, pH balanced, CHD appropriate, all Medline products. So in the morning, mostly the techs give the baths at night. We want to make sure if they have dry skin, we moisturize it. We have a lot of moisturizing products. We also, some people aren't dry, they're more moist, so we have preventative products to prevent skin breakdown. So we want to manage that moisture. So they might just have periods of incontinence. They might just be extremely diaphoretic people, and you might want to give them an extra added layer. This acts like a rain guard. You apply it very thin to areas of moisture, and then if water was to come onto this product, it would beat up just like your car with rain guard, and it would just roll off. So it gives your skin that protective layer. So we want to make sure that we're familiar with our products and we're using our products, because the main thing is prevention, prevention, prevention. And we have a lot of skin-based products, products to wash your skin. And then we also have for prevention is our foam dressings. We just recently upgraded to the Elite in Life 5-layer foam dressing. We used to have 3 layers. So the 5 layers gives added protection for prevention. So if you have a bony prominence, thoracic spine, and there's no openings, but you can see the protrusion of the bone, and you want to apply one of the 5-layer foam, both tech or RN or PT, anybody can apply a dressing to protect the skin, and that can stay in place up to 72 hours. And they have the gentle border, so you can still do your skin assessments. You're able to peel it back just to assess your skin and replace it. We also use the Elite in Life a lot for moisture management. We just picked up a couple different products here. This is for your peg tubes, your trachs. A lot of times you get a lot of moisture around those areas, leakage, and you really need to manage those secretions. So before you get any kind of MASD around any kind of opening, whether it's a trach, a peg tube site, we want to manage that moisture. So you can also put your preventative products around, you know, your peg site, not your trach site. But, you know, you think about what you have and how you can protect that skin. Now, we also picked up a little 4x4, just foam for moisture management. And you can hold that in place with any kind of device, whether it's regular tape or Tegaderm, the sheet of Tegaderm over it. It doesn't have the sticky side, so you can use that on an area of injury, where the other ones you can't use on an OD stage 1 or a DTI. You can only use them for moisture management and prevention. But this is another alternative, just in case you needed that type of dressing. You can use it similar like the Stratazorb, like the border gauze, the island gauze. So, any questions? No. I just want you to be aware that we have many, many products and that they're not all kept in everybody's CarX. Feel free to reach out to me, Mel, any of the educators, your leader, you know, SPD, just to see if you're looking for a particular product. And you can also ask your leader to stock a particular product. I just was told this wasn't stocked on 5 North. They're going to ask leadership to please stock it. They were very interested in the product. So Linda would definitely work with you. She has no problem. I already went through the adhesive removers too, because we're finding that we're getting a lot of skin tears from people removing IV sites, tapes, and adhesives. So we used to have the spray bottle and the wipes. We only have the wipes now. You just gently apply the wipe and it gently lifts up the tape adhesive. So we have that. And then of course we have our new Comfort Glide that we've been using on 5 North. I see you. 5 North is pretty proficient. You guys are doing a great job. The main concern is that we're finding more layers underneath the patient. So we want to make sure that you know that these are the only 2 layers that are going on the bed. These are your sheets and this is your chucks. There is not another layer. If you add another layer, you're reducing the effectiveness of the bed surface, whether it's a low air loss, gel foam, whatever bed surface you're using for each layer you apply, will reduce the effectiveness of that bed surface. So we're defeating the purpose. We want to make sure we only use 2 layers. People say, well, what about incontinence or this? Well, they're having frequent loose bowel movements. Maybe you need a fecal collection device or the moisture management systems of the PureWicks and the condom catheters for urinary moisture. These are stocked. These are changed as needed to stay with the patient, and this is to prevent shearing too, and it eases the lifting of the patient and positioning of the patient in the bed. It really does work. And just remember, 2 layers. Currently not using this at all on the envelopment. There is no studies that say that you can put 2 layers of linens on an envelopment. Right now, the studies show only 1 layer, so we're not using it on the envelopment. So the envelopment is out. Every other bed surface we can use it on in this building. And we have an algorithm that you can pick up or check out so that you can stay. Oh, I wanted to go over real quick. The wound algorithm for RNs, it gives you empowerment. If once you populate a wound on your flow sheet, in your avatar, it populates and the algorithm will tell you exactly what treatment to initiate, the products available, and who to notify depending. Wound care, the provider. main thing, always notify your provider. If you have any questions, though, reach out to Mel and I, and Gayan, and any educator. Thank you.